Welcome to Open Enrollment for the City of Kansas City, Missouri Trust. Open Enrollment is your opportunity to choose benefits for the year ahead. You will find choices to keep you healthy and improve your quality of life. Let's take a look at the comprehensive Blue Cross and Blue Shield of Kansas City medical benefits available to you as an employee of the City of Kansas City, Missouri Trust. These benefits are designed to keep your healthcare costs low and your coverage complete. You continue to have 3 HMO plans and a PPO plan option. We are also introducing 2 consumer-driven health plans. If eligible, you will also be able to have a health savings account, or HSA, along with these plans. It's important to make sure the hospitals you visit will be in-network with the plan you choose. If you are considering an HMO plan, it is especially important to confirm the hospitals you visit are in-network since there is no out-of-network coverage. The PPO plan options will allow you to seek care in or out of network. With a PPO plan, you also have access to our Blue Card network. You can visit more than 6,000 hospitals and 800,000 doctors across the country. The Blue Select Plus PPO network has a limited network. It is made up of 5 counties in Blue KC's 32-county service area. The 5 counties are Johnson and Wyandotte counties in Kansas, and Jackson, Clay, and Platte counties in Missouri. This plan has a lower cost because of its smaller network. You'll want to make sure your providers participate in this plan before enrolling in it. Again, you'll only have 5 counties in Blue KC service area with in-network providers for the Blue Select Plus plan. The other counties in Blue KC service area are considered out-of-network, and your out-of-network benefits will apply. When receiving healthcare services outside the Blue KC area, you will be in the National Blue Card network, shown here in green. Services in this network will be paid at your in-network benefit level. To look up a provider and see participating networks, use the Blue KC Doctor and Hospital Finder, available on mybluekc.com. We encourage you to register for a mybluekc.com account if you haven't already. There, you'll be able to view providers that are in your network, view your claims details, print a temporary member ID card, and more. All Blue KC members have access to telehealth. Telehealth gives you and your dependents access to doctors and nurse practitioners from the convenience of your smartphone or computer to help treat common medical concerns such as colds, flu, fever, rash, abdominal pain, ear infections, and migraines. No appointments are necessary, and the service is available 24 hours a day, 365 days a year. With telehealth, you will never pay more than $39 per visit. This is less expensive than an urgent care or ER visit. To take advantage of telehealth, download the Amwell mobile app and follow the registration steps. Another important tool available to you is RX Savings Solutions. RX Savings Solutions will show you ways to save money at the pharmacy for a prescription you or a dependent takes through email notifications, and if you sign up on mybluekc.com, text message notifications as well. This is a simple way for you to save money on medications. Let's review your current plan options. There are no changes to the current plan designs. You can continue to choose from 3 HMO plans with copays for all our healthcare services. The hospital benefit has a limit that you will pay for services of 5 copays per calendar year for inpatient or outpatient services. The PPO plan has an out-of-pocket maximum of $2,500. This includes your deductible and coinsurance only. Your copays do not apply toward this amount. All traditional HMO and PPO plans offer prescription drug coverage. Blue KC categorizes each medication into 3 tiers. At the retail pharmacy, your responsibility is a $12 copay for Tier 1, $35 copay for Tier 2, and $60 copay for Tier 3. The prescription list can be found at mybluekc.com, which will give you a list of all covered medications and the corresponding tier level. You can also use a mail order option through Express Scripts for your prescriptions. You'll receive a 102-day supply at 2 times the retail copay, so $24, $70, and $120 for each respective tier. It's important to know there are some prescriptions that may require prior authorization and have quantity limitations or step therapy requirements. Please refer to mybluekc.com for more information on prescription drug coverage. Next, let's review the consumer-driven health plan, the qualified high-deductible Blue Saver Premium Plan. There are 2 parts to a consumer-driven health plan. The first part is the PPO plan offered through Blue KC. You'll have access to the same network as the traditional PPO plan, as well as the new, more narrow network, Blue Select Plus. The second part is the Health Savings Account, or HSA, which is a funding vehicle for tax-favored contributions and disbursements offered through UMB. With the Blue Saver Premium Plan, you'll have a $2,600 embedded annual deductible and a $5,200 family deductible. All covered services are subject to the annual deductible. That includes healthcare services like office visits, inpatient and outpatient services, diagnostic testing, radiology, urgent care, emergency room services, and prescription drugs. There are no copays with this plan. On this plan, the deductible is the same in and out of network, but coinsurance does vary based on in and out of network utilization. If you are seeing an out-of-network provider, you'll be responsible for the out-of-pocket maximum of $5,200 for an individual or $10,400 for a family. Once you meet your deductible, Blue KC will pay 100% of any additional covered services. The second plan is similar to the first Blue Saver Premium Plan, but the new Blue Saver Base Plan has a smaller network. The benefits pay the same in-network, but it's important to note the out-of-network benefits. The deductible on this plan for out-of-network is $5,200. The total out-of-pocket maximum is $10,400 if you go out-of-network. Please check to make sure the doctors and hospitals you use are in the Blue Select Plus network. For prescriptions, it's important to understand you are responsible for the entire prescription cost until your annual deductible is met. Then both retail and mail order prescription drugs are covered at 100%. Prescription drugs are credited to your deductible at the time services are rendered at the pharmacy. Any Blue KC discounts will be calculated at the time of your purchase. Let's review a claim and prescription drug example if you're considering the consumer-driven health plan. When you visit the doctor, you will pay the negotiated fee. In this example, the cost of the visit is $140, but Blue KC has a negotiated fee of $65. Your doctor will submit your claim to Blue KC. We'll apply that negotiated pricing and send you an explanation of benefits showing your responsibility is just $65. You'll pay your doctor directly. That amount will be credited toward your deductible. Here's a prescription drug claim example. Let's say you fill a prescription that costs $150. Blue KC has a negotiated fee of $135. That negotiated fee will be applied in real time at the pharmacy, and you'll pay the $135 charge and receive an immediate credit in that amount toward your deductible. After your deductible has been met, all covered prescriptions will be paid at 100%. Next, we'll go into details about a health savings account, part of the Blue Saver plan. A health savings account, or HSA, gives you more control over the money you spend on healthcare. The HSA is an individually owned, tax-advantaged account that may be used to pay for qualified medical expenses or saved for retirement and certain long-term care expenses. It's portable, meaning it stays with you for life. Even if you change jobs, become unemployed, or retire, your HSA funds stay with you. The HSA is a great way to save on taxes, but remember, you do have some responsibilities with this account. As the HSA account holder, it is your responsibility to ensure you meet HSA eligibility requirements before opening, contributing, or accepting HSA contributions. And remember, you must be enrolled in the Blue Saver plan before you can open an HSA. It's also important to know the annual maximum contribution and the catch-up contribution if it applies to you. The 2017 annual contribution maximum for an individual is $3,400. It's $6,750 for a family. You may only use HSA money to pay for qualified medical expenses. Otherwise, you may be subject to income taxes and a 20% penalty. Here you'll see a list of some qualified medical expenses. After you turn 65, the 20% penalty no longer applies, but you will be subject to income taxes unless you use the HSA money for qualified medical expenses. It is also your responsibility to keep itemized receipts to substantiate all HSA withdrawals as required by the IRS. You can conveniently pay for qualified medical expenses directly from your HSA account with your Blue KC branded debit card. It's important to know withdrawals from your HSA account can only be made after money has been deposited into the account. You can also reimburse yourself when you pay for qualified medical expenses with another form of payment using UMB's online reimbursement transfer tool. The expenses must be incurred after your HSA has been set up. Let's take a look at the differences between a health savings account and a flexible spending account, or FSA. With an HSA, you must be enrolled in a qualified high-deductible health plan. With an FSA, you can be enrolled in an HMO, PPO, or qualified high-deductible health plan. There are also differences in the maximum contributions allowed with each account. With an HSA, you can roll your balance forward year to year. On the FSA, the use it or lose it rule applies. Another important difference, the funds are only available as deposited in the HSA. With an FSA, you have access to the entire plan year contribution immediately. With your new plan, you will receive routine preventive care services and procedures at no cost to you, regardless of what plan or network you choose. These services are fully covered by Blue KC. A few things to know. First, all preventive services must be obtained in-network, and the services must be coded as routine preventive care to be covered at 100%. So what that means is, if you go in for your annual physical and the doctor asks you to come back in 6 months to recheck your blood pressure, the follow-up visit is not a preventive visit, and the plan's deductible or cost sharing would apply. Second, annual physicals can only be obtained once in a calendar year, January through December. You can access a complete list of routine preventive services on mybluekc.com. Be sure to carefully review all of your benefit options before enrolling so you can make smart decisions for you and your family. If you have any questions, please call the customer service number on the back of your member ID card. Remember to log into mybluekc.com as there are many self-serve options available on your member portal. Here's to a healthy 2017.